Recording in progress. Good morning, honorable members, honorable minister, and the team from DSD, as well as our support staff. Good morning. I see we are a quorum, so we can start with the meeting. Honorable members, I just want to welcome you to the Select Committee this morning, and a special welcome to the minister and the team from DSD. We welcome you to our Select Committee on Social Services. Marcia, can you please flag the agenda?
Good morning, Chairperson. Good morning, members, Minister, Deputy Minister, and colleagues. I'll do so, Chair.
And a special welcome to the Deputy Minister as well. You are welcome to our committee. Honorable members, the agenda is in front of us. Can we get a mover for the adoption of the agenda?
Chairperson.
Yes, Honorable Adriaanse.
Good morning, Chairperson. I move to adopt the agenda. Thank you.
Thank you, Honorable Adriaanse. Can I get a seconder?
Chair, I second the adoption of the minutes. It's Honourable Du Plessis, or Member Du Plessis.
Thank you, Honorable Du Plessis, for the seconding of the agenda. So we are now at the next item on the agenda, the apologies. Marcel, can you please present the apologies?
Good morning again, Chairperson. I received an apology from Honorable Breed. She's unavailable for the meeting. Thank you, Chair.
Thank you, Honorable. Thank you, Marcel. Can I get a mover for the adoption of the apology? Honorable Adriaanse.
Honourable Chairperson, I move to adopt the apologies. Thank you.
Thank you, Honorable Adriaanse. Honorable Du Plessis.
Honourable Chair, I move to adopt the... oh, goodness. I second the adoption of the apologies.
Thank you very much, Honorable Du Plessis. I don't know if it's just you two that is awake at this moment. But honorable members, we now at the next item on the agenda, the briefing from DSD in terms of their strategic plan 2025-26, the annual performance plan as well as their budget. But Honorable Minister, the DSD did briefed us in the first term in terms of this. So I will request that you give us that you, Honorable Minister, and the team can give us an overview as well as go straight to the revisions on this plans. Thank you very much, Honorable Minister. Over to you. Honorable Minister, I think you are muted.
Thank you very much, Honorable Chairperson. Apologies for that. To yourself, Honorable Chairperson, honorable members of the Select Committee, Director General of the DSD, Mr. Peter Nechipale, the SASSA CEO, Mr. Themba Matlow, Acting CEO of NDA, Mr. Tabani Buthelezi, senior officials of department, and senior executive of the entities. Good morning to all of you. Wish to thank you, Honorable Chairperson, for the invitation to come and resubmit our strategic plan, annual performance plans and budget, following the retabling of budget by the Minister of Finance that was approved by Parliament. Honorable members, I come before you after we've experienced a couple of major events in the country. One I would like to start with is the devastation caused by the heavy rains in the Eastern Cape, where more than 100 lives have been lost and families displaced. For those who passed on, we say may their soul rest in peace. As we had seen on the news, Honorable Chairperson, we did visit the province, the team of DST, with both CEOs on Monday, the 16th of June, with the entire portfolio. The events that follows the situation, we thought as the sector we needed to get there to make sure that we see and experience what our people are going through. And having seen that, we had to do something. And as such, immediately, as we find SASSA on the spot, we confirm their visibility, and also we made sure that they work with everybody else through its social relief of distress programs. They also acted swiftly in that regard to assist those families whose homes were severely affected during the floods. To this end, Chair, SASSA has been active on 8 established sites where people are served with 3 nutritious meals a day, reinforcing the agency's commitment to immediate food security. They have been hard at work to restore dignity of all those affected. Moreover, they are now providing assistance with school uniform to children who have lost their uniform and assisting families towards the burial cost. The provincial government, social development, has been providing psychosocial support to the families and other humanitarian assistance they can provide. Honorable Chairperson, members of SASSA, through the regional executive manager, ensured that the internal audit committee was present from the beginning to ensure that every cent spent is accounted for. After citizens' outcry, Chair would remember, on the matter of justice for Cwecwe and other related gender-based violence and femicide cases around the country, the President requested the Justice, Crime Prevention and Security Cabinet Cluster to come with 90 days plan of action to combat gender-based violence and femicide. One of the decisions of the cluster was for DSD and Department of Women and Youth with People and Disability. They should host a roundtable discussion with all relevant departments and civil society, academia, and the communities to discuss this and respond to the petition delivered during the marches around the country. At roundtable discussions were held in Attersville on Friday, the 13th of June, successfully supported by the Minister of Police and the MEC of Social Development in Gauteng. This came after we concluded the Child Protection Month, which was launched in Tabanchu in Free State Province and closed in Limpopo. We also commemorated the International Day of Elderly Abuse Awareness in Fort Beaufort in the Eastern Cape. Honorable members, we held all these working together with traditional leaders and faith-based leaders. Yesterday, we closed the Youth Month with young people around the country in Gauteng. The youth was empowered with direct opportunities and funding in growing their business and new opportunities for new ventures. We did this with partnership with private sector and other government departments. Honorable members, allow me to report to the NSOP this when I was appointed as the Minister of Social Development. I did make commitment to create stability through filling the permanent post, starting with top management. The Department of Social Development has not had a Director General for about 8 years, Chair. We are now 1 year in office as 7th administration. I'm therefore glad to announce that Mr. Peter Neshipale was appointed as a new Director General of DSD. As if we understood the time the nation is going through, where the gender-based violence and femicide is really rife and it is unprecedented. I also appointed Mrs. Akele Mahangu as Deputy Director General responsible for welfare services, as well as Ms. Tandeka Ncomo as the Chief Financial Officer. Honorable members, it also gives me a pleasure to introduce Mr. Themba Matlow as Chief Executive Officer of South African Social Security Agency. And we appointed him within the time, as we might be aware that the contract of the former CEO came to an end sometime in June. Mr. Temba is bringing with over 22 years of public service and a strong track record on grant administration. He is already hands-on, boots on the ground, leading the agency from the front. Chair, these key appointments came at a time when our country were consolidating towards the realization of the National Development Plan Vision 2030 through the new medium-term development plan 2025-2030. Chair, we are here to brief this Honorable Select Committee on the updated strategic plan, annual performance plan, and budget for the 7th administration of the Government of National Unity. And Chair, I'm glad to announce that the Auditor General of South Africa also had an opportunity to review these plans for technical robustness. They recommended that we send them, presented to them in order for them to strengthen our plan, which they have done that. As part of the 7th administration, Chair, the President announced 3 strategic priorities of the medium-term development plan as part of the last contribution towards NDP Vision 2030, which becomes more crucial for us to consolidate for the next 5 years through the implementation of strategic plans and APPs. The strategic plans and APPs of social development portfolio are embedded into the MTDP 3 strategic priorities. Strategic A is strategic priority 1, drive inclusive growth and job creation. And B, which is strategic priority 2, reduces poverty and tackle the high cost of living. And 3, capable, ethical, and developmental state. One of the key priorities of us as DSD is strategic priority 2, which is to reduce poverty and tackle the high cost of living. This priority is the main one for us as it is centered on our social protection mandate, whilst other departments are also expected to contribute. Chair, the plans that we are presenting here today provide a strategic direction to the department and articulate how the felt need of our people will be addressed. GST portfolio continues to recommit itself to improving the quality of life of our people, especially our beneficiaries. We had to dig deeper and relied on our agility as we adopted innovative ways on providing the much-needed social service to a multitude of poor people and vulnerable. While DST continue to be severely underfunded, currently social grants are a major source of income support for 45% of South Africans' population. The results of the 2022 census are further proof that our investment in the social assistance program is working because it has lifted millions of our people out of the poverty. The demand for social service continues to rise amidst the growing burden of social ills such as unemployment, widening inequality gap, crime, teenage pregnancy, substance use disorder, and gender-based violence. The unemployment of social service professionals is emerging as a pressing issue across South Africa. In conclusion, Chair, the Social Development Strategic Plan, APPs, and budget reflect the commitments of the NDP Vision 2030 Government of National Unity Statement of Intent, MTDP priorities, and DST-specific sectors priorities, so to improve the quality of life for the poor and vulnerable. Honorable Chairperson and members, with these few words, let me hand over to the Director General and his team, Mr. Peter Nitshipale, to lead the actual presentation to the Select Committee. I thank you, Chair.
Thank you very much, Honorable Minister, for the opening. Honorable Chair and members of the Select Committee, we will be giving you not everything as we have requested, but I think the highlights and also indicating the areas where there are changes in our APP. In the strategic plan, I think nothing has changed, it's still the same. But I think we'll give both the highlight of the strategic plan and also the highlights on the APP. Thank you very much. I will now request Pastor Maluleke, Chief Director responsible for planning, to take us through the strategic.
Thank you very much, Director General Mr. Peter Neshipale, for the opportunity. Greetings to the Honorable Chairperson, Honorable members of the Select Committee, our Honorable Minister, Honorable Deputy Minister, the Special Advisors, the DG CEOs of SASA and the NDA, the DDGs, colleagues. Thank you very much for the opportunity. I'm going to make a presentation on the strategic plan 2025-2026, 2029-2030, as well as the annual performance plan for 2025-2026, and also the budget will be presented through our chief to be briefed. I'm trying to move the slide. Okay, just move. Okay, so thank you very much. And just to give a contextual background briefly, to say that as the Department of Social Development, we're implementing a mandate which is derived from the broader social protection as expressed in Section 9, 10, and 27 of the Constitution, and different pieces of legislations as the department, and also the implementation of Chapter 11 of the National Development Plan, which deals with social protection in the country, which seeks to reduce vulnerability, alleviate, and ultimately prevents poverty and empowers individuals, families, and communities through a range of social development services that we provide as the department together with our entities, and also to remind the honorable members that we are a national department with concurrent functions. We provide oversight functions to our entities, SASA and the NDA. We also have a statutory body, the Central Drug Authority, as well as the public interest institution, which is the South African Council of Social Service Profession. We do have limited services that we provide directly to the public. Do that. We provide NPO services as well as maintaining the child protection register. Honorable members, the strategic plan and the APP that were presented here was developed in line with the framework for strategic plans and the APPs, which provide direction to national and provincial government institutions on short and medium-term planning. This work has been a product of strategizing sessions. Our Honorable Minister even convened the Social Development Lekgotla, which was well attended by our 9 provincial departments of social development, the non-state sector, academia, and so on. So it was an extensive consultation, including preferences. These strategic documents were also endorsed by our DSD governance structures, including the audit committee, the sessions that we, Deputy Minister, together with SASA and the NDA. Both the draft strategic plan and APP were submitted to DPME for analysis. We submitted in October last year in 2024. We received feedback. The strategic plan and the APP were updated accordingly. The strategic plan, the APP, as well as budget were initially tabled in Parliament on the 4th of April 2025 as directed. They were, however, retabled in Parliament following the tabling of budget speech by the Minister of Finance, because in terms of Section 27, subsection 4 of the PFMA. So once the budget is tabled in Parliament, it says the accounting officers must table the measurable objectives in Parliament. In this case, these are the strategic plans and the APPs. And we also had an opportunity where the audit committee reviewed the strategic plan and the APP. So the strategic plan remains unchanged. For retabling, we didn't change the strategic plan. It remained the APP that were changed. You can only radically change the APP if the strategic plan have changed in terms of vision, mission, as well as the outcomes. So, and here is just the process. I think I've already covered it. I want to move with speed. While we developed the strategic plan and the APP, we normally look at the environmental scan deeply and especially the SWOT analysis. So in addition to that, we looked at SWOT analysis, which identify the strength. There are strengths that we have as the National Department of Social Development. I was even thinking this morning that we have a strength in our minister. We didn't have a DG for the past 8 years. Today we have the DG and other DDGs. And one of our strengths as well is to have a unique mandate. We are the only Department of Social Development in the country, as well as SASSA, that distribute the social grants. So this makes us unique. So we optimize on our strength and also the opportunities that are there. We work well with the NPO sector. We have a well-established NPO sector. This also assists us as well. We also have aspirations as well. This week we had a meeting with the DG, the management committee meeting, where the DG was outlining the aspirations of the department, providing the intellectual leadership and on matters concerning the role of social development in realizing the society innovations in the National Development Plan. And of course, we are result-based. The plans that I'm presenting, they are result-based, they are evidence-based. Here on the DSD mandate value chain, just to say to the honorable members that we recognize oversight by Parliament, in particular, Section 55 of the Constitution is clear how we need to account as the National Department of Social Development and how we should implement the policies and legislations. So largely, we develop policies as a department. This year, we'll be submitting the basic income support. It's one of the policies. We also have the disability policy and so on. So these are some of the policies, including those that were finalized and approved, the different pieces of legislations that we are implementing as the department and standards, as well as the guidelines to facilitate the implementation of policies and legislations that we implement. We also conduct capacity building. You will see when I share the APP, we do have targets on capacity building. We need to capacitate the sector on the implementation of these policies and legislation, and also conducting the reviews. This is the DSD strategic posture. I think here is VIMIVA, which is vision, mission, and values. Our vision is a caring and self-reliant society. We are a caring department. On the other hand, we are mindful that we need to create a self-reliant society. We have the mission, which is our reason for our existence, which is the provision of integrated, comprehensive, and sustainable social development services. We have also set ourselves one impact to say, for this current MTDP period, what is that we want to achieve, what is the impact that we want to make as a department. We are saying that it's improved quality of life for the poor and vulnerable. So for us to achieve the impact, we came out with 3 outcomes that contribute to the impact statement. One outcome. The first one is to reduce the levels of poverty and vulnerability to social ills. The second one, empowered, resilient individuals, families, and sustainable communities. The last one, which is functional, efficient, and integrated sector. This one contribute to the achievement of those 2. And these outcomes, honorable members, are appropriately aligned to the MTDP. So this just to demonstrate the alignment on different plans, starting with the National Development Plan. I think it's important to mention that the National Development Plan, Vision 2030, is aligned to international commitments on the continents and globally. We used to talk about, even now, the Sustainable Development Goals 2030. These were incorporated within the NDP, and this also include Africa Agenda 2063, the GNU Statement of Intent, as part of the 7th administration, which brought the medium-term development plan, having migrated from the medium-term strategic framework. We used to implement the medium-term strategic framework. We've migrated to the medium-term development plan. I think the key word there is development. In other words, these plans need to be developmental in nature. Our Honorable Minister has already mentioned the 3 priorities that we're implementing. Just to mention them again, strategic priority 1, inclusive growth and job creation. We have a contribution to make as articulated in our strategic plan and the APP, especially around the extended public works program. Strategic priority 2 is to reduce poverty and tackle the higher cost of living. I think in the main, that's where we are contributing as aligned to the mandate of the Department of Social Development. The third one, which seeks to support the first 2 priorities, is a capable, ethical, and developmental state. So as the Department of Social Development, working with provinces, SASSA and the NDA, we were able to come up with the sector priorities that all of us contribute. So therefore, the strategic plan and the APP take a cue from all these priorities, starting with the NDP, GNU statement, the MTDP, and also the annual performance plans as well, which is the APP. We also implement the annual operational plans, and bulk of our work is there. We have just concluded performance agreement of all officials within the department to make sure that these strategic plans and APPs are achieved at the end of the day. And also our Honorable Minister with the President. So these are the DSD portfolio medium-term development commitments. There are 7 in number. This is what we have provided as a contribution working with DPME. The first intervention on this one, which is aligned to priority 1 of the MTDP, is to increase access to nutritious food to all vulnerable individuals. The indicator number of individuals vulnerable to hunger accessing food through DSD program for the medium-term target of the current MTDP period. We have targeted 1.5 million. At the end of the MTDP, which is Vision 2030, we have targeted 2.9 million. This is the work that our provincial Department of Social Development will be doing while we provide oversight. The next intervention is to optimize social protection within the available fiscal resources and protect the value of social grants for children, the elderly, persons with disability, and the unemployed. There are three indicators there. One is number of beneficiaries in receipt of older persons grants. For the medium term target, we have targeted 5,662,603 beneficiaries in receipt of older persons grants. End term is 5.4 million. Just to be quick, number of beneficiaries in receipt of child support grants, we have targeted 13.9 million. At the end of the MTDP, we have 14.1 million number of beneficiaries in receipt of disability grants. For the midterm target, we have targeted 1.1 million beneficiaries in receipt of disability grants, and end term target is 56,589 beneficiaries in receipt of disability grants. The next intervention is to strengthen the implementation of the National Drug Master Plan to ensure South Africa free of substance abuse. We have midterm as well as end-term targets there. The midterm target is 135,715 service users who access substance use disorder treatment services. Then at the end of the term is 272,810. Number of victims of GBV accessing psychosocial services. The midterm target is 224,549. Then end term target is 449,408. So link social assistance with other forms of support to lift people out of poverty. We have number of households accessing sustainable livelihoods initiative. The midterm target, it was 1.4 million households accessing sustainable livelihoods initiatives, and ultimately 2.9 million households accessing sustainable livelihoods initiatives. We also have an indicator number of cooperatives linked to economic opportunities. For the midterm target is 757 cooperatives linked to economic opportunities. The end term target is 918 cooperatives. So what I'm showing now, these are the SONA commitments. The president pronounced on SONA commitments. So these commitments needed to be part of the annual performance plan, so that they are monitored, so that we can be accountable, so that the president, even in the next SONA, can be able to account to the nation. The first action is to build an integrated system of support to the poor and the unemployed. We committed, what event to the presentations? They said we shouldn't present all, but yeah. Okay, so and then the National Integrated Social Protection Information System implemented. We also have the extended public works opportunities, the basic income support as well, that will be presented or rather submitted to Cabinet. The last one is National Strategy to Accelerate Action for Children, that will be submitted. So these are the strategic focus areas. I'll be quick, DG. The first one is to contribute to poverty alleviation and food security through social grants. We'll also do skills development, job creation through social entrepreneurship, basic income support. I've already mentioned it. Gender-based violence and femicide is one of the strategic focus areas. Employment of social service professionals, which is also critical to address social behavior change challenges and help curb rising social ills, alcohol and substance abuse, youth and women empowerment, care and protection of children, the elderly and persons with disabilities, and also with the shrinking resources in government, one of the strategic focus areas is social compacting, so that we can be able to augment the resources. The last one, creating a capable, ethical, and fit for purpose. So I think I'll skip this, the measuring outcomes. I've touched them in one way or another, but I think it's important to mention that we have committed ourselves still to obtain a clean audit outcome as part of the strategic plan. The next piece I've already mentioned it, and also the digitalization of DSD services, which is important. To want to digitalize paperless is important. This is just to say that we've identified strategic risk, looking at the outcomes and the indicators that are in the strategic plan. We have put action plans to ensure that these outcomes are achieved. And as we achieve the outcomes, ultimately we'll achieve the impact statement that we've came with for ourselves. This is the outlook of the DSD APP. Last year we had 48. This year we have 42. This is just to align with the MTDP priorities and also the budget that we have. The APP was aligned to the MTDP priorities, the SONA, as well as be retabled the strategic plan and the APP. I mentioned earlier that the strategic plan was not changed. We only updated the APP. So these are the areas that were affected. Two programs were affected. Program 4, the original APP target was calls received through GBV Command Center responded to for interventions. This target was removed because the work is already happening. So in other words, it's more of a duplication. This target is already covered by non-financial data. Provinces are reporting on this. The National DSD also monitors the implementation of the National Strategic Plan on Psycho-Social Services Policy in 15 GBVF hotspot areas in line with the National Strategic Plan. We also had an original APP target, which is to submit the National Plan of Action for Children to Cabinet. Looking at the SONA commitment as pronounced by the President, it was important that we align to that. That original target was therefore replaced. We submit the national strategy to accelerate action for children and for children to Cabinet. Then the last one in Program 1, monitor implementation of community mobilization and empowerment framework towards active re-entry in 9 provinces. This was deleted. I must say that this was actually moved to the annual operational plan to allow for the development of comprehensive monitoring tool in line with the development, with the district development model, because prior to implementation, you need to develop the monitoring tool. I think I will conclude. I'm not sure, DG, if I need to speak to this, and but this just to say, this is how our APP is. Program 1 has 5 targets. Program 2, 1 target which relates to distribution or administration of social grants. The APP targets per program. In Program 3, we have 7 targets that will be implementing. Honorable members, there are also outer years. We are demonstrating. I will show you some slide to show that it's not only just for the current financial year. Program 4, we have 17 targets that will be implemented. Program 5, we have 12 targets. So total targets in the APP are 42 in number. So the rest is just to demonstrate that while we implement targets in the current financial year, there are also 2 Okay.
Chairperson, we just
TG, we can't hear you at all now.
I think the TG is having a problem with the network because the line so far was not yet good.
Yes, I also think that, Honorable Sibande. Let us give them 5 minutes.
that we have. This is the updated areas that we have in the slides. So we have concluded the presentation, Chairperson. Thank you very much.
Thank you very much, TG. Honorable members, the presentation was concluded. We want to thank the Honorable Minister with her team for the presentation. Honorable members, any questions or clarity or comments? Honorable Aris.
Sorry, Chairperson, I have lost connectivity. Let me just get clarity. Is all the presentation through?
Yes, we have received the updated one. So if you have any questions regarding the updated one or the one that they presented just now, Honorable
Okay,
Aris.
no, I'm fine, Chairperson.
Okay, Honorable Makwele.
No, thanks very much, Chairperson. I don't have much to say because, like you said, the only question is not just for clarity to say. I heard the minister in her opening remark. He also relayed of the intervention of the department in that disaster that happened in the Western Cape, in the Eastern Cape, which we really appreciated. But I know this one, it might not be her competency. That in most cases, this thing of BDM, District Development Model, whereby this thing of the disaster relief only happen at the provincial level, and then at the local level of the municipal, they don't have disaster. I just want to check that as department, how does this thing affect them as department? Because in my other responsibility previously, when I was the mayor, we had a problem whereby when there is disaster, there is what we call a red tape, where we're supposed to intervene. We need to follow steps to the province up until national, whereby they will say at some point, province, they will say this is not their competence, it's only national competence. But in terms of them at the national department, how do they respond quickly at the local government, maybe even using their offices? Or I just want to check that. And the last point, which I also heard when the new Director General, which we really welcome him and really congratulate the minister for making sure that she feel that the critical position, whereby now in this department we can proudly say we've got somebody who's accountable, who will make sure that this department is run more effectively and efficiently. Really, but I heard in the presentation saying that as the department they are on the verge of rolling out what we call basic income grant. Given this, given the budget in terms of the budgetary process that we are now going under, we are now just about to finalize. I just want to check that in terms of the budget, are they really ready? Because indeed, our people at the ground, especially those that are without a single income, they are really struggling. We will really appreciate that, so that that basic income, which I know that is not a permanent solution. Basic income is not something that people must get permanently. It's only for the relief. While as the government working together with the private sector, we make sure that our people are employed. I just want to get the issue of the budget, whether in terms of budget, are they ready also that they will be able to implement that program successfully. I thank you, Chairperson. Other than that, everything is still the same. We are covered. And we really want to appreciate the minister that all the time he will always avail herself to the select committee. And thank you, Chairperson.
Thank you very much, Honorable Makwele. Honorable Aris, yes.
Yes, sorry, Chairperson, I have again lost connectivity. It is just one input that I would like to make, if you allow me, please, ma'am. I just want to check with the legal services. Are legal services are important, and how will DSS ensure that compliance with the relevant social development laws and policies? And then also, Chairperson, what measures did they have put in place to ensure social welfare are delivered by capable individuals? And then also, I noted that the older persons register is not part of the APP, and what the implications of this is, as this is an important target. And did the DSD aim the 272,810 service users who access substance use disorder? And what is the basis for that number of services users? And how many GBV victims currently use the social services? And how many EPWP jobs was created? And they must also give us an indication in which provinces it is. And then the 4.9 million in 25-26, the 5.2 million in 26-27, and the 5.5 million in 27-28 allocated to employee compensation, wage agreements, increases, and they must please elaborate and explain that more to us. And then I want to check with SASSA their cross checks in terms of with which departments they have agreements. Did they have agreement with the NSFAS in terms of their child support? Did they have agreements with Home Affairs, Correctional Services, and etc.? Thank you, Chairperson.
Thank you, Honorable Aris. Honorable Du Plessis.
Thank you, Honourable Chair. It is mainly around the SASSA grants and checking the income of people on SASSA, also ensuring that there are not duplications within the system. Just want to find out where we are within the department on those processes. Thank you very much, Chair.
Thank you, Honorable Du Plessis. Honorable Fanny.
Thank you very much, Honorable Chair. Let me also do the same by welcoming the presentation and also greeting the Honorable Minister. with the presentations that they presented to us as a select committee. I must mention that, Honorable Chair, that as the select committee, we appreciate the interventions that the the minister have been making in ensuring that they are coming closer to the realizations and the objective of a NTP plan in order to achieve a society that is livable, and also addressing these societal challenges that the country is confronted with, understanding the socio-economic challenges that they are operating under. So I just wanted to raise that. Chair, I think that the current challenge that that we are confronted with, on a constant basis, is the question of backlog, specifically when it comes to the question of beneficiaries that are supposed to be benefiting due to a number of areas that you can mention, whether the child does not have necessary documentations, whether mine is to check the collaboration between the departments, if because they have been raised by my colleagues. The question of collaboration between the departments specifically, because we're dealing with, with the question of higher education. There are those who are qualifying to qualifying at this level to benefit as beneficiaries. When they go to apply for NSFAS, you see that there is a discrepancy. It's either the information is not available whilst the person is currently a beneficiary. How do you bridge the gap between the two? Because in most cases you discover that those who are supposed to be benefiting are not benefiting. Instead, those who are not supposed to be benefiting. So how do you collaborate? And also you have information that is available on the system. You just punch a button if someone is qualifying, whether you go to Home Affairs. Home Affairs, just you punch a button, you see that this person cannot be, because of the information that has been. I just wanted to check that one. The second one, there is this question of that they have raised. It's a societal challenge that we are confronted with. One of misuse of the substance abuse, whether it took drugs or alcohol, especially to those who are underage. What mechanism are we put? Because the situation is worsening, even though there are mitigating strategies that are put in place. And all of those people are becoming a burden at the end of the day on the department, because of you discover that they will fall under a certain category that the department must be able to look at. I know it can be a collaboration also on this one between the department and the department of other departments, or Department of Health. That's the second one. The third one, there is these NPOs, that are benefiting from the department, but they are not doing the necessary services to our communities. What measures are you putting in place in ensuring that these NPOs, are delivering what is meant, and also the mandate that are being given to them are exactly that mandate, because some of them, they are just, when you are following them, you discover that no, they are just free riders. They are not, especially your early childhood development, and look towards the creation location, the environment that they are putting, the small kids under. It's a container, just a rock container. When it is cold, it's unbearable. When it's hot, it's the same situation. So even though they are benefiting, and you discover that they are not utilizing the funds for those particular purposes. I just wanted just to raise those issues, Chairperson. Thank you very much.
Thank you, Honorable Feni. Honorable Sibande.
Thank you, Chairperson. I'll also follow my colleagues to welcome the presentation and also to say to Minister in particular, Minister Utwalashe, thank you very much, Minister, to be with us as Cut, because some of the ministers, that's where they are making a mistake. They don't come physically to be with us, but yourself, it shows that your background, you are from the ANC Youth League. Nevertheless, let me go to the question now. Mine is to motivate and to give a space so that the department can give more elaborations on some of the matters. Number one, I'll start by the issue. DG, in your input, you spoke about the policy and legislation that is implemented. You see, I'll be very much impressed if you can maybe indicate one or two legislation which you are dealing about, because you know why. It is very disturbing. I'm a little bit perturbed by some of us, in particular, some of the members, whereby we agree in this forum like this, in the where we are as a committee, and then this thing is taken to the House. At the end, a person which was with us, if there is a legislation which is approved by us, they will challenge it to court. I'm a little bit disturbed on that behavior of such people. But to share with us only one or two. And then also, I was touched when you commented about the issue of MTDP, success to malnutrition. And you spoke about your midterm, which your target was 1.5. End of the term is 2.9 million. You see, now, here comes my question. I'm a little bit also not convinced, because my little experience taught me something. Most of the time, many departments, when they give us some of the reports, it does not cover rural areas. Most of the time, if they give reports, they give reports like with the background of the province, which are well developed, or the background of the people which they have, while they have not. They are not giving any special attention. Meaning, in short, practically, like most of the time, people will report on Western Cape and Johannesburg, and also in KZN, Durban, not in the rural part of the Durban. And then also, you indicated about the issue of master plan on drug abuse. That one, I will be very much also happy if you can give us a now. Because another challenge which I've realized from my little experience in the province where I'm coming from, Mpumalanga, as well as Gauteng and many more provinces, people, they've become, I don't know what. That's why I support this master plan on drug abuse, that it must be implemented as a matter of urgency, because our kids, if you go to some of these townships, they became monsters. We were even scared of greeting them, whatever. Dirty, filthy, and smelling as well. I don't know what type of a drug which they're using. But with this one, we'll support it if you do it correctly. And then I was also touched with the issue of the SONA commitment by the president. With this one, you said you are going to build an integrated system for the poor people as per the commitment of SONA. The thing is that I'll be very much happy or grateful if you can elaborate more, because my little experience is that in some of the rural areas, they are not yet connected. There are systems. They are struggling with some of the systems, which is not linked with the provincial whatever. They are still suffering because they don't have network, etc., etc. Because nowadays, a lot of things are communicated through the issue of network. For an example, in outcome 3, you spoke about digital system, of which is very, very much important. But in supporting my argument is that how do you deal with that matter? Because you must have plan A and plan B. Plan A normal is that digital system and connected. Digital system is equal to be connected. But if you're not connected, how you are going to implement your digital system? And then lastly, just a comment. Chairperson and also DG, in terms of SASSA targets, if you wanted to reach it in terms of SASSA targets, I've got an experience somehow in my constituency, whereby there are a lot of MOUs or memorandum of understandings which are being signed by the department, maybe through the province, and give it, for an example, for sake of argument, the province will give the authority to the post office that they must give those, the funds for the people monthly, whatever their salaries. Then only to find that some of these people whom we are signing MOUs with, they are not complying, they are not implementing as it was anticipated. Therefore, what is your system in terms of monitoring a proper implementation of your own program? I'd like to thank you there.
Thank you, Honorable Sibande. Honorable Adriaanse.
Thank you, Chairperson. I'll be short and sweet. I'm not going to switch on my video again, as you have seen me already on the meeting, and to save the bandwidth. It's crucial that we realize that when there's no economic growth, the unemployment and hence the poverty rate will rise, and hence this department's role is even more important than ever. So thank you for what you're doing in the first instance, and I believe you will keep doing so in a credible way. I welcome the job opportunities being created by EPWP workers, but for clarity purposes, I would like to know, as described in the active citizenry report under Program 5, is upskilling included with the EPWP workers? Is there a plan for that? Because in many municipalities, we have EPWP workers employed and deployed just as ordinary cleaners. Many cases, they're sitting under trees and receiving the money. But if we can upskill these workers, we can give them a future doing something that they can take care of themselves. The old saying goes, if you give a man a fish, he will eat for a day. But if you teach him how to fish, he will eat for the rest of his life. So I'm very passionate about the EPWP worker system, that we must teach them how to fish. And if it's just eating for a day, it's not enough. And that's why I need the clarification on that. I welcome the idea of digitalization of the DSD system, because that will annihilate the possible fraudulent activities on it, and the processes will be cleaned up. And I would like to know if there's a specific time frame to attach that to the whole of South Africa, taken into consideration the internet incapacity in some of the rural areas of South Africa. Then the black card rollout. The recent advertisements on the radio is, don't worry about your gold card. It will still be active, it seems like forever. Why was the sense of urgency lost with regards to the rollout of the black card? This is something I really don't understand. We were told it's a necessary step to be taken because of all the corruption involved with the black card and the struggles with the service provider at that stage. Now I don't understand why all of a sudden the black card and the gold card is still operational. If you can just put us there, bring us into confidence on why this is now okay to have a gold card still, and there's no sense of urgency to further roll out this black card. I appreciate your time. Thank you. That's it from me.
Thank you, Honorable Adrianse. From my side, I have just one issue that I want the department to clarify for me. In Program 4, Welfare Services, Policy Development and Implementation Support, in all the outputs and output indicators, you have indicated number of districts capacitated on the white paper. And in 2025-2026 financial year, you indicated capacitated 11 districts on white paper on families. So it goes on to each and every output and output indicator. I just want to request the department just to give us in writing, it doesn't have to be now orally, in writing the different districts for the different output indicators, so that we as a committee can monitor that it's not the same district that is having this output indicators in each in the same district. Thank you very much, Honorable Minister. Over to you and the team.
Thank you very much, Honorable Chairperson. I will just talk to those that I'll talk on the policy, then the team will speak on the details. Thank you very much for the constructive questions, but also the beautiful words that we hardly receive when we have done better than we always do. Thank you so much. We really appreciate that. Chair, on the matters that talks to disaster management, I must assure the committee that as DST, we are permanently members of the disaster management that is led by COGTA, which is the one that led the charge in the disaster that took place both in Eastern Cape and KZN. We are sitting there on a permanent basis, and we do contribute into what you can now see as the outcome of those interactions. We are always there, especially because not only as DST, but as SASSA, who is a resident of the area where the disaster took place. So on how the province and local take place. Honorable members will remember that under disaster management, you will find your provincial and local chalk. They do sit in that structure. This is how serious that structure is, because it's a holistical structure that must look at everything when the disaster has hit that area. On the matter of basic grant or anything that talks to, we wish to inform the members that, or remind the members that this matter is now with the cabinet as per the sixth administration decision. It is now with the cabinet. Of course, we did get a feedback with one of the DDGs. We'll talk on it. But I also want to commit to say if the committee would love us to come and brief them thoroughly on what is the progress thereof, but we'll just talk today on the highlights, because now we all also call it basic income support grant, so we can do it, Chair. I also want to speak on the matters whether we are more of rural or urban. I want to assure the committee once again, Chair, the seventh administration is very, very committed in serving the rural people in particular. But of course, we never leave behind the people who are staying in affluent areas. Already, all our events and activities, 99% of them have taken place in rural areas. We have been in Limpopo, in Mujaji area. We have been in Free State, in Tabanchu, of course, working with traditional leaders. We've been in the Eastern Cape, in Matole, in Fort Beaufort, Raymond Mhlaba municipality, it's the most rural. We've been in Pumalanga, in Musika Ligwa municipality, it's also a rural area. We have been in Western Cape just to balance. Chair, we've been in Western Cape on the days where we were celebrating family. We went to meet with the Eastern Cape community. This is not informed by just common sense, but we consult the reliable research that tells us the story if we are addressing the issue of violence against elder people. We went to Matole and Fort Beaufort, Raymond Mhlaba municipalities, because the scourge is rife over there. So we had to go there just to go and interact with people, but also we further educate our people on why this should not be done. Chair, on the issue of black card, remember these were findings by the Reserve Bank when they looked closer at the yellow card at the point when they picked up some problems and challenges. Therefore, they imposed these changes, and these changes had to be made. Yes, we accept that, Chair. There were delays, which as the DSD, we got involved when there were frustrations of people standing in long queues. But ourselves and SASA, we came in and we got on the ground. We were there on those queues. We assisted our people with chairs and water where we could. And we submitted our report on our findings, both to our PC as well as to the PC that deals with Department of Communication, which this is where this matter of black cards is, because the black cards is produced and distributed by Post Bank, which directly account to Department of Communication. Chair, about the bills that are coming up, we've got Child Amendment Bill, we've got NDA Bill, we've got VSS Bill, we have got Older Persons Bill, we've got Maternal Support Policy. All these are in the pipeline by ourselves to the cabinet. Some already presented, and as such, we're waiting for the cabinet to give us a feedback. On the on the Older Persons Bill, you would know the NCOP took a very active role in that regard, and as such, it is now on the table of the president for him to sign that bill. This is the progress that we are making in that regard. But I'll give over to DG and his team to further elaborate on issues that were raised as questions. Thank you very much, Honorable Chairperson.
Thank you very much, Chair and Minister. I think there are some other questions that we need to respond to briefly. I will request my team to deal with because they're specialty. You have asked a question on the EPWP, and I think that's two questions on that in terms of the targeting, and also whether we are upskilling them so that they should not be dependent on IP. I will request the Jacques van Zedam to do that. That will be followed by you ask an issue with regard to substance abuse, but I think we just give the glimpse in terms of that issue from. I will ask DDG Mahangwa to follow on that issue. And there was an issue with regard to SASSA, the issues of I think the minister touched on one, but I think you need to, the brand new CEO will come on in terms of the details on this issue, including the MOU that you have, collaboration between SASSA and other institutions, NASFAS, Home Affairs and others, and the issue of the NPO. I will respond to the issue of the NPOs in that order. Thank you very much. Can we, Jacques, on the issue of EPWP?
Thank you very much, DG, and good morning, Honourable Minister and Chairperson and Honourable Members. Just on the EPWP questions, the one was asking for a number of jobs per province breakdown, which we will provide following the meeting. Basically, the target that has been set in the MTDP is the sum of all the provincial targets, both in the midterm as well as in the end term. The social sector EPWP is shared with other departments, particularly the Health and Basic Education Department. And then those projects are mainly implemented through the provincial departments of those departments. So as coordinating department, one obviously has to put together all the numbers to come to the targets, but then also provide guidance and direction and management support. Then on the second EPWP question about around upskilling, the social sector EPWP has a component which is quite innovative to create pathways for program participants to obtain skills in order to join the mainstream economy and not remain dependent on public works type jobs. So that component, of course, is one, not part of the core EPWP budget that comes from National Treasury. But two, it is also quite an expensive component. So what the department does jointly with the other departments in that space is to actively seek partnerships and funding arrangements that would create such opportunities. So just to give a practical example, coincidentally, which was launched this week in eThekwini, a group of 50 youth EPWP participants were enrolled in entrepreneurship and digital skills training at the eThekwini FET College, which is a 6 months program.
So you can imagine the cost implication. One of the enrollment. Secondly, the trainees received a monthly stipend, as well as, because it's digital training, a laptop computer. So these were young people who left grade 12 last year. But that's a partnership project. So there are several others like that as well, which can be upscaled, as one manages to secure more partnerships and more financial support for such programs, and that is obviously the ideal. There are several other such programs, but I'm just thought the most recent example would be quite useful. Then, Digi, there was just a question as well on the monitoring system, and how much we know about our own program in the provinces. So what the department has been developing over a number of years thus far, and it's not complete yet, but the implementation is taking place in stages, is an electronic monitoring system together with the provinces, which would enable the capturing of performance data by provinces at district level, as well as by non-governmental organizations that are funded by the provincial and national departments of social development. So that would give one a much more real-time access to fairly detailed and disaggregated data geographically, as well as disaggregated by sex and age, etc., of the work of the department. Now, whilst that is under construction, what we have had for very long is a more manual system of non-financial data reporting by provinces. So because it's manual, it works in the quarterly cycle, and then information gets collated so that the national department is able to report on the service delivery by itself, the provincial departments, as well as the NGOs that are funded by the department, on a quarterly as well as annual basis. And those reports are available. But as I've said, we are in the process of digitalizing it so that it becomes electronic. It's already been rolled out in 3 provinces. The rest are gradually coming until the whole project would be completed by the end of the current term of government. Thank you very much, Chair. Over to the next speaker.
Which provinces are we piloting?
Yes, Northwest Province, and Free State. The pilots have been completed. KwaZulu-Natal is underway. The intensive part is the training of officials at district level, both of the provincial departments as well as from civil society organizations that have to report because they receive funding from the department. So that training element obviously takes time. One cannot just sort of put a system out there and assume it will work. Officials need to be trained, and it is a bit of a sort of culture change as well. In a public services has worked on manual systems for decades, and now transition to electronic systems.
If names of provinces. Please quantify it for the committee so that committee is aware. Please.
Thank you very much, Minister. I think yes, the areas where we will, I think we'll be able to do that in provinces. Can we go to the next one? The issue is like which provinces are piloting the M&E, that thing, and how many people are trained. I think those are some of the things that we need to. Okay, let's go to the next one. DDG Mahang.
Okay.
There was an issue about the scourge of substance
Yeah.
abuse and including alcohol.
Okay. Thank you, DG. Good morning, Honorable Minister, Honorable Chairperson, and Honorable members. I've noted about 3 questions related to our branch. The first one is around the older persons register. I would like to confirm that we do implement the older persons register. We started by training all the 9 provinces so that they know how to capture information on victimization of older persons. It does not reflect on the APP, but it's on our operational plan, and we are implementing the older persons register. Then the second one was around the statistics, that we have the midterm statistics for both SUD as well as GBV victims. These statistics, they are actually informed by the previous performance. We've been capturing or monitoring these numbers the last 5 years. So now we have a baseline, and based on that baseline is the one that has assisted us to, target or reflect this target. And it's also important to indicate that it's not only the numbers from national, but it is all the 9 provinces. All the 9 provinces, they've got systems in place where they are capturing the number of people that are regarded as that are suffering from substance use disorders. And we also have a system that captures victims of gender-based violence in terms of the psychosocial services that we are providing. So these are the projections for the next coming 5 years. And we may even exceed these numbers because of the awareness campaigns that we are rolling out in provinces. The more people get to know, the more people demand services. So the numbers could even increase. The third question was around what mechanisms we have in place that addresses underage drinking. Yes, indeed, that is a problem that we have identified, and we are working with other stakeholders because the issues of children cut across other departments. For instance, the Department of Education, they are affected. The Department of Health, they are affected. Arts and Culture, they are also affected, and us. So we are working closely with them to address the issue of underage drinking. And we are also strengthening the collaboration through the IMC. Just 2 weeks ago, an IMC interministerial committee that addresses both these pandemics, which is the GBV as well as the substance use disorder, has been established to ensure that we fast track the interventions and make sure that these issues are really reduced or they are eradicated in our communities. So we are looking forward to participate in the IMC and make sure that we achieve all the set priorities that they've set for us as a department. The last one is around the ECD. Yes, the ECD has, there was a function shift. It has moved to the Department of Basic Education. However, we are still working with the Department of Education as far as the parents are concerned and other age groups. So we are working together to make sure that we achieve the set goals. Thank you, DG.
Thank you very much. Can we then go to the CEO of SASSA? There are several questions that have been asked in relation to the SASSA area. CEO of SASSA.
Good morning to honorable members and good morning to the Minister and DG. One part of the question Minister covered quite well on the issue of disasters. The other question was regarding to whether we do have a MOU with other sister department and other stakeholders with regards to the income checks. We can confirm that yes, we do work with Correctional Service, Home Affairs, PESAL, UIF, GPF in terms of the means testing and checking all the eligibility of the grants. We have the real-time data exchange every time applications are done, especially when you onboard the new applicants. We do have set of MOUs with different departments. We also have an MOU with the NSFAS on issues of student applying, but we must emphasize, honored members, that the stipend for student is not treated as an income. We only check the caregivers that applies for grant. We don't check the student. But we do have MOU in place with regards to the income check of students. The other one, DG, was the issue of how far we with the review. On the details, I think the EM grants can just support me there. I must just indicate that we do reviews annually. So the review is not a new thing. The regulations emphasize that we must do reviews continuously just to support the eligibility of people receiving the grants, because we don't want to see a situation where there's double dipping in the system. So that we do annually. But now we had to emphasize and also strengthen our review mechanism so that we start doing it frequently. So that we check the eligibility of all the people that supposed to receive the grants, so that money is not wasted, and we also pick up some of the fraudulent activities in the process. I think, Brenton, you can just maybe indicate how far we now with the process that we've already institutionalized with regards to the review process. Thank you very much, DG. Brenton?
Thanks, CEO. Good morning, Honorable Chairperson, members, Minister, Deputy Minister, DG, CEOs. Just to pick up where the CEO asked me to come in. At present, we've started so maybe I should just give a little background. As CEO mentioned previously, we've always done reviews, as CEO mentioned, and in the past, a lot of our reviews were targeted on public servants. So, for example, your PASEL and your GEPF pensioners, etc., which is roughly around 2022 when we started those. Back then, I think we had about 160,000 public servants that we put under review because they were receiving grants, and about 60,000 GEPF pensioners. And if one just looks at then the progress over the last 2 years, you'll note that in the last year when we did reviews, there were only about 150 of each, about 300 in total between GEPF and PASEL. So the review system does then aim to first of all, clean up our database quite significantly of people who may not be qualifying for grants. But we also then continue to do that just to make sure there's not too many people slipping through the cracks. This year, we've started a slightly more ambitious project where we're also beginning to get access to non-public servants data. And thus far, we've managed to get about 210,000, just a little bit more than that, records of people who possibly don't qualify. So note the review process is not we saying people don't qualify for the grant. It's just that we've become aware that circumstances of some people may have changed and that they may no longer qualify for the grant, but we do give them the right to then come in and basically represent themselves, redo the application process to see whether or not they still qualify for the grant. So it's not necessarily just suspending the grant. We give people about 3 months before we suspend the grant if they don't come in for the review process. So thus far, we started in June, and we don't just schedule the whole 210 in one go. We stagger them across the year so that we don't overwhelm our offices or put too much pressure on our local offices. And for the month of June, we saw about 12,000 people coming forward for the review process. So that's essentially where we are at the moment, CEO. Thanks.
Over to you.
Thank you very much, CEO and Branton from SASSA. There was on the issue of maybe I should add on that, maybe just to describe the approach all NPOs that are funded by the department, there is a stringent, as part of the policy implementation, a guideline on how they need to be monitored, which apart from the service delivery monitoring in terms of the getting the data from them, there is also an approach that is done currently in provinces, where provinces at a local level, service offices visit all the NPOs, firstly during the due diligence that is required, whether they are fit to be given funding. Secondly, to also on a quarterly basis to go to these sites and identify issues, because there are issues within the NPOs that are problematic, including the issues of governance. So they check those issues, and then they also, it's done on a quarterly basis physically to visit all the NPOs. And I think in relation to our role on the ECD, I think DDG Mahonga mentioned, remember it's now with education, and I think they are strict in terms of how these are done. But I just wanted to add. The other issues is in relation to the legal services, whether we have got a legal services that monitors this. I don't know, Lumga, you want to come on, or I should continue? Is that, yes, we have got a legal services that does the monitoring of all the legislation that we have, but notwithstanding their presence, we always get people to take us to court for one area or other. But when we look at in terms of the cases that have been brought and how when we appeal, the success rate is higher because we have to, but also to understand, to also note that, yeah, in law, they say it's a very open book. You say this word today, tomorrow the word changes, it's no longer like that. But we have got legal services that deal with those issues, honorable members. The last one is that, Honorable Chair, you have requested us to send some information. We will send the information on the districts that we are targeting quarterly, so that the committee can monitor our delivery on those areas, in terms of the training which you identified on program 4, and I think there is something also on program 5. We'll be able to give you the district an outline of the second quarter, third quarter, and the fourth quarter that is remaining. And we will also, as I agreed, we will give you a detail of the EPWP targets that we have, distribution per province, that we will send those things to the committee. Thank you very much. Over to you, Minister, if you want to add anything.
No, thank you very much, Chair. I guess we have covered almost every question, whether to explain the policy, its implementation, as well as what we expect it to do today. Unless Honorable Chair and members still have questions to ask, we'll await. Thank you so much.
Thank you very much, Honorable Minister. If there is any questions that is not responded to, we will, through our secretariat, we will communicate to the department, Honorable Minister. And Honorable Minister, we want to thank you for honoring your commitment made to stabilize the department with the appointments of critical positions. And we want to congratulate the DG and the other appointees for being appointed in these positions. We hope this will benefit our communities when it comes to better service delivery from your department. Honorable Minister and the team, we want to thank you very much for your responses. We really appreciate your time and commitment in terms of service delivery to our people. especially the poorest of the poor. Honorable Minister, you and your team are released because we as the committee will proceed with our meeting. Thank you very much, Honorable Minister.
Thank you, Chairperson. We really appreciate that. Thank you and bye-bye.
Bye, Minister and team. Honorable members, we are now at the adoption of our minutes of the 25th of June 2025. Can I get the adoption? Honorable Adrianse, you are on top of it. And then Honorable Fanny.
Thank you, Honourable Chairperson. I move to adopt the minutes. I have read it. Thank you.
Thank you very much, Honorable Adrianse. Honorable Fanny.
Thank you very much, Chairperson. I'm seconding the adoption.
Thank you very much, Honorable Fanny. We are now at other businesses. Let me just get this one, honorable members, just a minute. Marcel, can you please the program of next week, can you please just give the info to the honorable members, please? In terms of that, on the next week, honorable members, we're supposed to have the briefing by SASSA on their strategic plan and their annual performance plan, but they have requested that we shift that because they are busy with their budget vote. So now we will, next week meeting, we will discuss, the committee will have a discussion on the report by the Public Protection on Dora Regional Hospital. So Marcel will forward the information on the group. So that is all from my side. Is there anything else from the honorable members? So there's just a change in the briefing that we will receive next week. Honorable members. Now, thank you, Honorable Adrianse. I can see you are on top of it. Honorable members, I think we are at the end of our meeting. So this meeting stands adjourned. Thank you very much.
Thank you, Honourable Chairperson. I'll see you later. Okay, bye.
Bye.
Lekker dag, voorzitter.
Dankie, achtbare lid van die komitee, Sibande.